Hi, my name is Japina, and I'm here today to do a presentation on the importance of lymphatic drainage incorporated with machines. So lymphatic drainage massage and machines is a presentation we're doing today to help practitioners, whether you're a doctor, surgeon, esthetician, using devices like emsculpt from BTL, that it really still does not replace the need for a lymphatic drainage manual therapist whose hands and knowledge of the lymphatic system can be applied to using the machines and also as a pre and post treatment to maximize the results of these machines. I cannot emphasize enough, part of the passion of me doing this talk today is that as we grow into an industry of technology, which is very exciting, I myself am adding new technologies to our clinic, like the Balancer Pro and the Biocharger, PEM, PMF machine and red light therapy, that we need to be very cautious and very careful that we are always following the first Hippocratic oath as a medical provider to first do no harm before we treat a client. I have come to understand that part of what causes side effects for clients or a negative effect is really not understanding the drainage system, due to the fact that the drainage system is truly the waste removal system of the body. So if we're stirring up debris and fluids in the body and not dealing with the waste removal of the body, we may be causing innocently our clients quite a lot of havoc in the body versus really giving them, a good treatment that is not going to have so many side effects. The majority of side effects I see from machines is because the lymphatic system has not been understood or addressed correctly. So in emphasizing the lymphatic drainage with machines, would really like for practitioners to be able to take a basic course in understanding what is the lymphatic system, where does it lie in the body, how does it correlate to its response and feedback using something like an emsculpt or really sculpture, any medical device, and how can we help any and all providers in our facility understand the basis of the lymph system and how we could maybe integrate more pre-post treatments with a machine or with a, say, for example, esthetician in the clinic that can perform just a very basic Vater style face drainage before or after a treatment so that the client can have a more effective result and can easily remove the toxins that these pieces of equipment are stirring up inside of the lymphatic system. The lymphatic system is strongly connected to the nervous system. So, and using RF technology and all these electromagnetic fields, we do need to understand that we are stimulating the nervous system and putting it into drive and into somewhat of a sympathetic mode, which is not a healing mode. Our body heals in parasympathetic, and the vagus nerve is triggered or in parasympathetic to go to rest and digest. And sympathetic is causing us to run from the tiger, be busy and in a stress zone, which is not negative, but if we do not bring the body back into parasympathetic after stimulating it, it does not allow the body to naturally get rid of these waste products. So in my understanding of meeting with different surgeons, and what an amazing event at the BTL, it was really exciting for me to see that, us as lymphatic drainage therapist specialists, massage therapists, we really have an opportunity to help you fill that gap and reduce the amount of complaints or side effects that your patient may have from using these machines by truly understanding the diversity and the application of the lymphatic drainage system and understanding your machine more, asking your provider, what are the modes for lymph drainage that I can use? And really ask these questions. They probably have these modes, but again, I'm finding that we do need to bring it into our attention, into the forefront of our treatment, not the back end of our treatment. Reason being simply because we do have a very inflammatory lifestyle and diet in America. It's a very much drive-through lifestyle, which is why we do end up being inflamed. We have busy lifestyles. Rarely do we really take the time to rest and digest when we're eating. So the colon, the area of the body where we need to be going to the bathroom, a lot of people are generally congested, not digesting. Um, we take that body that's not digesting, going to the bathroom and removing waste, and we use very extreme RF treatments on the body. We aren't necessarily doing justice for the lymphatic drainage system. So again, it's not to, discredit the benefit of the machines, but we do have to be very aware that we really have to bring lymphatic drainage into the forefront of any and all technology that we are starting to use in the future. Manual lymph drainage and having a physical therapist be able to read the lymphatic drainage system and ask these really important drainage questions as part of an intake form, like, are we going to the bathroom regularly? Are we able to urinate easily? Are we having regular bowel movements? These are all very important aspects of having a healthy lymphatic system, as well as a healthy glymphatic system, which is the lymphatic system inside of the brain, which is a lymphatic system all in of itself. If the lymphatic system is building with plaque and it's not healthy, it's not draining, generally this is shown as puffiness in the face, it's shown as sinus congestion problems. It can even show up as aging in the face. And so if we're not looking at the lymphatic system, the sinuses, the neck area, the puffiness, is this drainage or is this fat? Why are we accumulating fat in the cervical nodes here? Then again, we're not completely giving the client a holistic treatment. How do we correct this? We correct this by learning about the lymphatic system, the superficial pathways, and the deep pathways of the lymphatic system, and how we can work with machines and hands-on with people to be able to create a more holistic approach with machines, and really being careful not to remove our hands and our touch out of our practice, because that is where there is proven biofeedback and neurological healing from having actual physical touch in our practice. So my invitation for you as a practice and my inspiration and passion to come into this camera and talk to all of you surgeons, doctors, and estheticians, amazing providers doing phenomenal things that we can't do, is to create this bridge where we can really take the knowledge of a lymph drainage therapist. That's really what we specialize. It's the anatomy and physiology we are in every single day. Our hands are inside the fluids of the body, knowing where it's congested or inflamed, etc., that we can give you a very simple version of what that lymphatic system is and some very basic modalities. You can teach your providers to really make an exceptional difference and set you apart from what other clinics are doing that have become extremely hands-off. I believe that clients will come back for that kind of special touch, if you would like to call it, and really featuring in your devices and machines that you're using, understanding the lymphatic drainage modes that you can offer in those machines as part of a pre and post treatment to your services. So my invitation for you is that if this is something you're interested in or want to know more about, I do offer virtual one-on-one clinical mentoring for these clinics. I myself have a clinic. I should have started with that introduction. I have a lymphatic drainage specialty clinic in Vancouver, Washington. I've been doing lymph drainage massage for over 24 years, and I do have a clinical practice of massage licensed MLD massage therapist. And the method and modality that I've created is called the Chapina method, also known as cohesive therapy. Our Center Cohesive Therapy Healing and Rejuvenation Center really treats the whole energy, the energetics of the lymphatic system, the manual drainage. We do pneumatic pressure, standard water, but we take it a step further by really using tools and technology in our center as well. And so we too are expanding to utilizing this technology, which is why I found it so vital to express that until we do the lymphatic drainage techniques along with this technology, we're finding that it's causing unnecessary stagnation and side effects that can truly be prevented by understanding the lymphatic system and how it applies to our machines and our healthcare providers that we work with, including the front office. A lot of front offices are turning these machines on and off. So making lymphatic drainage simplified, easy to understand, easy to apply will create a sustainable way for us to really truly have the Japina method, the cohesive therapy, the cohesiveness of bringing everything together so that it flows flawlessly and easily for the patient-client experience as well as the provider. Um, that is what I love, and that is what I love to teach. And it's something we can teach in a Zoom room with a big group of people. And in the virtual space, I'm able to set up a table on my side and a table on your side in the clinic. What this helps do is it helps to have the whole clinic on the same page, and it helps to get you up to par with the lymphatic industry so that you do understand when your clients are coming to you asking for lymph drainage, that you can actually provide that for them instead of sending them down the road to a place that you don't really know what they're doing. So the methodology and modalities that I teach clinics is very systematic, very consistent, and very simple to use. So that is my offer to you. If it's something you're interested in, you can contact me at 360-904-4999. I will also include a link in the email for you to look at, and very excited to have this opportunity to share this information with you. Some of you weren't able to make the call today, so I decided to do a recording so you could read the information in your own time. Please try again. You can read this information in your own time, and also feel free to reach out to me for a consultation, a one-on-one as a doctor or provider. If you're just wanting to have, this conversation about how lymphatic drainage can be transformed inside of your practice, my passion really is to get more into the practices and empower practices to be able to offer this within their full walls versus continually referring out not just business, but honestly, an incredible financial flow and revenue that you can add to your practice that is already a demand that is going to only get bigger and bigger and bigger. And on that note, we will be next year opening a lymphatic drainage specialty massage certification program, which will be state approved, so that we can provide these programs for therapists, that you can send a therapist here to get trained and get into your clinic and literally be ready to treat your patients the minute they get out of school, which reduces confusion, liability, inconsistency of care, all these problems that we see on the table. We plan to resolve these and also have ongoing training and updated training, because learning never stands still. Technology is advancing every single day faster than the speed of light, and it is vital that we never stand still in our continuing education knowledge that can spread across the broad board of not just massage therapists, but doctors, physicians, surgeons. This is not limited to just massage therapists. The anatomy and the physiology of the body is one map and one program. It is not the nervous system I'm working on is not a different nervous system that you're working on. And so at the end of the day, in the bright future, we really start having these round table conversations and treatment plans that are truly holistic, where we're working on the same bodies, the same muscles, and nervous system in a more integrated way that makes sense for the overall client's outcome and goals. So again, my name is Japina Katerina. I'm based in Vancouver, Washington. I have a center up here, and I would be very happy to hear from you. Any information that I can do to help you, please use me as a resource. A little bit about our patients. We work with 80% plastic surgery patients, all of which are referrals through plastic surgeons in the area and internationally. We have plastic surgery clients who come in from Mexico City, Colombia, and in the Northwest area. And some of those surgeries are mommy makeovers, mastectomy, cancer patients. They could be patients who come in who have had major skin removal. We work with clients when they do have open drains, wounds, skin care, and we do all the garmenting, and really a full service surgery program that we've been doing for many years and will be launching more and more. We also provide lymph drainage for naturopathic doctors who have clients who are going through parasite cleansing, autoimmune, and so much more. We've been able to bring them back into life and be able to have daily functional activities, which is huge, like taking care of my kids, running normal errands without fatigue and pain. Um, and so really helping people have a functional life with autoimmune or recovering from parasite. And then we do natural sculpting with vacuotherapies and many other things that we're getting amazing results with. And overall wellness, maintenance. So when you're done with all your programs, it doesn't end there. The next step is maintenance. What is a good maintenance program for all of our clients who, everyone needs a maintenance program and everyone needs a treatment plan. So when they graduate from a treatment plan, how can we help them maintain their lymphatic health? The world has a lot of, things that we can't control and toxins. And so really the approach is to, consistently cleanse out the rivers of the body, clean out the fluids, and increase massive amounts of healthy blood flow so that we have those stem cells running through our body, doing the work that they're meant to do and not being bogged down by debris and garbage. So really overall helping many patients, menopause, women's health. That is the majority of our clients, and working closely with referrals from both of the major hospitals, Peace Health and Legacy Salmon Creek, which are in our Northwest area, and local, private owned clinics. So we're very proud of the work we've done in the last 13 years in this area, and it really is just the foundation of what we've created for the method to come into the future, where we're starting to marriage and merge into technology to be the next part of what we offer in our lymphatic drainage method and journey for our patients. Thanks again for your time today. I look forward to hearing from you and seeing any questions you have. Have a beautiful day. And again, it was wonderful to meet everyone at the BTL event. It's very exciting to see what's happening in this industry. And let's stay in communication. Have a beautiful day.